I'm Melanie. I'll be your student nurse today. Okay, I'm just gonna wash up real quick and put some gloves on and then we'll start the assessment. I'm washing for 20 seconds, putting my gloves on. And can I have your name?
Maria Pinella,
Okay, and your date of birth?
March 20th, 1996.
Perfect. And do you know your medical record number?
12345.
All right, great. I'm gonna go check your wrist really quick and I'm going to make sure that it matches with what I have in my chart. Okay, it does match, that's perfect. Okay, do you have any allergies to medication?
Nope.
Latex?
Nope.
Food? Environmental? Perfect. Also, I'm gonna check your vital signs. I see here in the chart that it says it's 118/62 for your BP, your heart rate is 68, respiration rate is 17, oxygen is 99%, and temperature is 98.7, so everything is normal. That's great. I see also in your chart that your doctor has ordered some saline as well as some oxygen, so I'm gonna check that the rates match and the medication matches as well. And I'm gonna check your nasal cannula really quick. Okay, there is no apparent skin breakdown, no redness. Check by the ears as well. Okay, perfect. I'm gonna follow the line, make sure there's no kinks. It does show that there are 2 liters, and it does match what the doctor has ordered. As well, the IV bag does demonstrate that there is saline. I'm gonna follow this line back, and I'm gonna check your IV line here, your site. There's no erythema, no redness. Is there any tenderness when I touch?
No.
Okay, perfect. Patient does not appear to have a urinary catheter. However, if they did, I would check the site for any redness or tenderness. As well, I would follow the line, and then I would check the bag for urine consistency, color, and output. Okay, what brings you in here today?
I have a headache.
Oh, okay. And when did this headache start?
Yesterday.
Okay, and about where on your head is it?
It's like right here by my temple.
Okay, and then when you're in the pain, how long does it last?
About like 15 minutes at a time.
Okay, and then is there anything that you do that makes it worse?
Yeah, if I'm like reading on the computer.
Okay, anything you do that makes it better?
Sleeping.
Perfect. Have you tried anything to treat it?
Just some Tylenol.
Okay, and then if you could describe your pain, would it be like a throbbing, an aching, a stabbing?
More like a stabbing.
Ooh, okay. And then if you could rate your pain on a scale of 0 to 10, 0 being no pain at all, 10 being the worst that you've ever felt, what would you say?
Probably like a 7.
Okay, well, it's a good thing you're here then. Okay, alrighty, and I am going to ask you, the patient, a few questions. Can I ask if you know where you are?
Sarasota.
Sarasota, okay, and the date?
February 5th, Friday.
Perfect, and you gave me your name and your date of birth, so patient is alert and oriented to person, place, and time. That would be A&O times 3. Okay, and then I am going to give you a quick skin assessment. I'm gonna check your scalp really quick. Okay, there is no apparent lesions, hair is evenly distributed. I'm gonna check your ears. Use my leg. Okay. Ears are not occluded, they are free of drainage and free of redness. I'm gonna go ahead and do an eye check real quick for you, if you wouldn't mind just putting your hand right here to separate that, and look straight at me. And again. And again. Okay, if you wouldn't mind taking your hand down and look at my pen. And again. Pupils are equal, round, reactive to accommodation and light. Sclera is white, if you wouldn't mind pulling your eyes down. Okay, conjunctiva is pink and moist. There is no drainage noted. I'm gonna look at your nose as well. Okay, ears are free of occlusion and drainage. There is no redness present. If you wouldn't mind sticking out your tongue, saying ah. Tongue is pink and moist, and uvula rises to midline accordingly. Smile for me, please. Smile is symmetrical. Perfect. I'm going to check your skin real quick. So if I wouldn't mind looking here. Okay, skin is warm and dry and appropriate for a determined ethnicity, or for stated ethnicity. I'm gonna check your turgor. No tenting noted. And I'm gonna check your fingers real quick. Capri fill less than 3. I'm gonna look at your legs. There is no edema, no redness, and no apparent abrasions. And I'm gonna check your toes. All right, calf refill less than 3 seconds on the toes as well. Everything looks great so far. And the next thing that I'm gonna do is I'm going to listen to your lungs. Okay. So every time that I put my stethoscope and move it, go ahead and take a deep breath for me. Breath. Okay. Breath sounds are clear, lungs sound equal bilaterally, no adventitious sounds noted, and patient does not appear to be in any distress and is not using any accessory muscles for breathing. Okay, the next thing that I'm going to do is I'm going to check your heart and your pulses. Okay, first I'm going to do the carotid artery one at a time. No thrills present. Carotid arteries are equal bilaterally there. I'm going to check your radial pulses. Okay, and I'm going to check your dorsalis pedis. Okay, pulses are equal bilaterally and they are a +2. Next thing I'm going to do is I'm going to auscultate your carotid. Carotid is free of bruits bilaterally. I will now do a cardiac assessment. What I'm going to do is I am going to I'm going to auscultate the 5 points of the heart. First one is going to be the aortic point. That's going to be at the second intercostal space, right sternal border. The pulmonary point, which is the second intercostal space, left sternal border. The Erb's point, which is the third intercostal space, left sternal border. The mitral point is the tricuspid point is the fourth intercostal space, left sternal border. And then the mitral point, which is the fifth intercostal space at the mid-clavicular line. Also, real quick before I do that, I'm going to just palpate the PMI, okay? And no heaves or lifts noted. Now I'm going to listen with both my bell and my diaphragm. I'm going to go with the bell first. Okay, heart sounds are normal across all 5 points. And S1 and S2 are present in all 5 points as well. The rate and rhythm is regular. Okay, now that we've finished the heart assessment, I'm going to just do a quick musculoskeletal check and check on your strength. Okay, if you wouldn't mind grabbing my hands, give them a squeeze. Okay, try to pull me towards you. Try to push me away. Okay, and your feet. Okay, try to push down on the gas and lift up to point towards the ceiling. Same thing here. Okay, muscle strength is at a 5 and everything appears to be equal bilaterally as well. Okay, and the last thing that I'm going to do is ask you, do you know how to use a call light?
Yes.
Okay, and it's right here for you, right there.
Thank you.
Okay, and I'm going to note that the bed is down to the correct level and the rails are to the correct level as well. And is there anything else I can get for you?
No, I'm okay.
Oh, one more thing that I forgot to ask you. Do you have any pain, numbness, tingling, weakness in any of your extremities?
No, I do not.
Okay, perfect. All right, thank you so much.
Thank you.
Wash my hands.